Okay ladies, let's talk about fibroids. Fibroids is the most common benign tumour affecting 1/3 of women up to the age of 40. As we know, fibroids is stimulated by the presence of hormones called estrogen and possibly progesterone as well. You can find increased incidence of fibroids with the oral contraceptive pill. Fibroids also grows in the first trimester of pregnancy due to estrogen stimulation. It's quite common in women who've not been pregnant, obesity, as well as African Caribbean women or African American women. Now, why is it common in Afro-Caribbean or African American women? We don't know. There's this theory that African American women eat a lot of fried fatty foods. I cannot prove or disprove that. However, fibroids is reduced, funny enough, in women who smoke, and they do tend to regress after the menopause. Now, it's interesting to know that 50% of women who have fibroids do not actually have any symptoms, and they're incidentally found if you're having an ultrasound or if your doctor manages to examine your abdomen and finds that you have a pelvic mass which is consistent with fibroids. Otherwise, the most common symptoms for fibroids is heavy bleeding, heavy periods. And this is quite common in 50% of women with fibroids. Now, with heavy bleeding, you would not expect to have bleeding between periods or bleeding after intercourse. That is not characteristic of fibroids. If you have any bleeding between your periods or bleeding after intercourse, then you need to see a doctor because there are other causes for that. Sometimes fibroids can cause painful periods, but this is not common. Fibroids, as you know, would cause abdominal pain, and depending on the position of the fibroids, they can press on the bladder to cause bladder symptoms such as urgency, incontinence, and increased frequency. Another common feature is infertility. Depending on the location of the fibroid, they can actually block the passage of sperm to meet the ovary in the fallopian tube, and it can also prevent implantation of the embryo in the womb. Usually when you see the doctor, they will do an exam to examine your abdomen. If you have an abdominal mass, this can be quite evident. Or with vaginal examination, if your uterus is bulky or feels irregular, there's a suspicion that you might have fibroids. In terms of investigation, you would usually have a pelvic ultrasound which would diagnose the size, location and number of fibroids. Fibroids can be multiple, or you can have a single fibroid. If it's quite large, you might need more than an ultrasound, so you might need a hysteroscopy, which is a camera test that looks at the womb, or laparoscopy. In terms of management, usually if the fibroid is not causing any problems, not affecting your fertility, not causing pain or heavy bleeding, you would usually leave your fibroids alone because, like I said, they do tend to regress after the menopause. However, if you're symptomatic, you might want to consider treatment. So medical treatment could be maybe going on the Mirena coil, for instance. However, this might be a problem because the location of the fibroids might affect the position of the Mirena coil. Or you might want to reduce the bleeding with medications like tranexamic acid, for instance. Or if you're considering surgery and the fibroid is too large, your doctor would usually give you a special injection that's meant to shrink the fibroids. However, what happens is that this injection can also induce a temporary menopause state where you get night sweats, hot flushes, no periods. And this can be quite alarming for a lot of women. And one of the long-term side effects is that these injections can induce long-term osteoporosis. So there are other surgical methods such as removal of the fibroids during the hysteroscopy if the fibroid is quite small, depending on the size and location of the fibroid. And also if you're planning for pregnancy, then a doctor will do what we call a myomectomy, where they'll remove the fibroid with preservation of the uterus. However, if you've completed your family, you're over 40 years of age, you're not looking to have more children or any children, then the doctor might suggest you have a hysterectomy, especially if you've had heavy bleeding, very painful periods or abdominal pain, and no other medical treatment has worked, and hysterectomy seems like the only practical option. However, do consider this. This is not something that should be decided easily because this does have long-term implications. You're not going to have children again because you don't have a hysterectomy. Some women like to have that feeling of having a womb because it makes them feel womanly. So consider counseling before and after surgery if you're going to have a hysterectomy. I mean, there are other options such as endometrial ablation. However, the doctor will consult with you on what's the best surgical option for you to have. I hope you've enjoyed this short video on fibroids. Please feel free to like, share, comment and subscribe to my channel.